Hello, my name is Chris Bannister. I'm the Nursing and Allied Health Professional Representative for anyone who doesn't know who I am. I just really wanted to welcome everybody to this session and to the rest of the 2 days. And everybody who came yesterday to our wet lab session, I hope you had a fun time. It seemed to be very participative. So have a chat to your colleagues so that everybody next year will be able to come to for 3 days. You will learn a huge amount and get some good experience from the wet lab session. I just really wanted to highlight a few of the initiatives that are going on at the moment within the CT Forum. There are a huge amount of educational courses and opportunities currently going on. We're going to put them as much as possible, as you can see, on our Twitter feed. Well, I'm not using the Facebook as much, but the Twitter feed's been quite hot over the last few days. And also, we have two websites for SCTS at the moment. There is the educational website, which is a brand new website created by the SCTS Education. So you can go onto that, and you can see all of these presentations that are being filmed over the next 2 days. They're all going to go on the website, so that you can get your colleagues to also look and see what they can learn from this session. And the main website will obviously have all the courses on it, when they are, where they are, so keep an eye on all those for the next few months. So really for education, we've worked quite hard following on from some surveys that we did over the last couple of years, really, looking at spaces in education and where people wanted some more education. And the most innovative one that we're working on at the moment is a Band 5/6 core skills course. We're still working on the presentations for that, and the first session is planned to start in April in Manchester. So it's going to be about a 3.5-day course aimed at ward nurses, Band 5 and Band 6, and they will give a whole gamut of cardiothoracic, ANP, how to look after patients, lots of different chest drains, anything you need to know. So please do pass that information on to your matrons when you get back, and keep an eye on the website for more information. We're planning to do that regionally, so obviously we understand that travelling to centres is very, very difficult. So those courses are going to be planned regionally. We're also going to try and get your trainers to come to the courses, so we can do a train-the-trainer situation. And therefore, if you can't get there to the course yourselves, then obviously the trainer will be able to come and then take all the information back to your centres and obviously disseminate that information to the Band 5 nurses. As I say, we're starting in April in Manchester. We plan then to go to Glasgow for all the Scottish nurses and everybody who wants to go there. 2 courses in London, and then we're working down throughout the country throughout the year. The other initiative that we're looking at starting later on in the year as well is a theatre nurse course. St Jude has worked with us, and they are very keen to start up a 1-day theatre nurse, cardiothoracic theatre nurse course, looking at skills and team working. And the first course for that we're hoping to plan for July this year. So do again, please disseminate that knowledge to the matrons, and we'll get as many theatre nurses to that as we can. Obviously, the courses that we run every year, they're still running. So we've got 3 SCP planned courses at the Manchester Skills Centre. They're on AXA website and also on the SCTS website. There's the Advanced Cardiothoracic course that is run in Birmingham, which is a 2-day course. Again, anybody who hasn't been on that, that's very practical, wet lab and small teaching. So please do attend that. And then finally we have a course which is entitled How to Set Up an AHP System. So basically that's a course for people who want to expand or set up their own advanced nurse practitioner health practitioner services. We ran that in London this year, in Birmingham last year, and again is a really useful learning opportunity for people who want to expand the service they already have or set up a new one. Finally, I just really wanted to say that we also have a Postgraduate Nurses Day every year at EACTS, and EACTS is the European Association for Cardiothoracic Surgery. So on the Sunday at that conference, we hold a Postgraduate Nurses Day, and the best papers from this session always go and present at that conference. So, you may well be invited yourselves to come and present at that conference, but please do keep an eye on both the EACS and our website to keep an eye on that. I blasted you with a large quantity of information about education there, but please, join the SCTS, and you get lots of good membership opportunities. As many of these courses as we're trying to do, we are running regionally. We're keeping the costs down. In fact, quite a few of these courses, the costs are actually free, but they are free mainly to members, and we are being pushed on that. So I do recommend, and the £30 membership per year is probably going to be well worth it, especially with revalidation coming around the corner. We've got a really, really interesting session today. Cecilia Anwin from the RCN is going to come and talk about general situation in the RCN and in nursing and allied health professional services in the UK at the moment. As we know, cardiothoracic surgery and medicine is undergoing quite a few challenges, so it'll be interesting to hear what Cecilia has to say. And then also we have the 2 INSQ fellows. Last year we advertised for an INSQ fellowship. Mr. INSQ is basically a retired cardiothoracic surgeon who lives in Monaco. He has no children. He is getting on in a few years, and he enjoys rock climbing and heli skiing. So as he lives in Monaco, you can imagine he's got quite a bit of money. So luckily for us, the Cardiothoracic Society is a benefactor from his money, which is really, really good. Last year we were able to tap into that fund, and we advertised for 2 £2,500 nurse fellowships. You'll be able to hear from the 2 fellows on their experiences that they've had, and I'm sure they'll be able to share all the work that they have learned with all of us. And I just wanted to say that this year we advertised the fellowship again, and unfortunately no one applied. So this is a great opportunity if you want to either set up a new service or expand a service that you already have. We will be re-advertising next year, so please, please don't waste this opportunity, because if it is seen that we're not going to use the money that we have been given by Mr. Ionescu, and I'm sure our medical colleagues will use it instead. So please do pass that on to people, and we'll re-advertise it. We'll give everybody good notice, but please do take that offer up. Just want to finally say we've got a really good packed schedule of talks over the next 2 days. And tomorrow we have got 2 prominent people from the RCN going to come and talk about revalidation, which I'm sure you'll all be listening to intently, scribbling down everything that they say. And also advanced practice, so that'll be really important for everybody. Okay. And also Jill Lay, who's here today is a clinical nurse specialist from California. She's going to tell us all about revalidation in the States, which I think will be a fascinating insight into how they've gone down that road. As I want to say, is welcome to everybody. I'm sure, as my colleagues will say later on when they're chairing, we do peer review mark all these papers. So if you are given a marking sheet, please fill it in. As I say, there's a prize, there's a poster prize, and the best marking papers get invited to EACS. So it is really important that these papers are peer reviewed. So please mark if you have to leave or you need to leave, please pass it to somebody else to continue to mark, and please give those in at the end. Keep an eye on the Twitter feed. Please keep an eye on the website. As soon as we have any more information, we'll put it up, and we'll have our email addresses on the website to contact us. Thank you. That's myself.
Thank you, Chris. Well, I'm delighted to welcome back to the Cardiothoracic